Get there, and then the email showing.
Good evening. I'd like to call the November 2nd, 2015 Davie County Commissioners meeting to order. At this time, if you would join me in the invocation. Dear God, as we come before you this evening, as always, we are thankful for the many blessings of life. We're thankful to live in Davie County. We're thankful to live in the United States. We're thankful we have the right to free governance and self-governance. We ask for your wisdom tonight as we make the best decisions we can for all the people in Davie County. In your name, amen.
Amen.
This time I would like to call on Mr. Neil Smith, a Navy veteran, to lead us in the pledge.
I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Entertain a motion to adopt the agenda.
So moved.
Second.
A motion and a second. All in favor? 5-0. Thank you. Next item on the agenda is the public comment period.
We have none, Mr. Chairman, that signed up today.
All right, thank you. Next, we have several presentations. The first is the 2016 primary election information, Tabitha Parrish.
Before I go over the 2016 elections, I'd like to give you an update on the election tomorrow that we have in the municipalities. We completed early voting on Saturday. The turnout has been a little larger than normal. We voted 239. In 2011, 4 years ago, we also had mayors, and we voted 222 then. Election laws are constantly changing. These three are the ones that have major changes for 2016. House Bill 589, it changed the election date, moved the presidential primary up earlier in the year, and they were basing that on the South Carolina primary. At that time, we were going to have a February election and also a May election. It also decreased the voting days that we would have for early voting, but we had to match the same number of hours. So we had to either increase our voting sites or make our hours longer at those voting sites. We chose to make our hours longer. Also, photo ID will be required when voting in person. That is not required for absentee voting by mail. And your curbside voters can show a photo ID, or they may show just something that has their address and name on it. Okay, acceptable photo IDs. These are the ones that will be accepted in 2016. The ones provided by DMV can be expired for up to 4 years. The others have to be unexpired. However, some of your military and your veterans cards do not have expiration dates, and those will be accepted either way. Voters who are 70 years or older, they can use a photo ID that is expired as long as they were 70 at the time that expired. Also, if someone shows up to the polls and they do not have a photo ID, they're offered a provisional ballot. That's a paper ballot. They will be able to provide that photo ID at the County Board of Elections office by canvas in order for that to count. Also, we are planning to have a presentation by the voter outreach team at the State Board of Elections January 12th at the Senior Center. so that we can get everybody thinking about photo ID, since that is the biggest thing that everyone's talking about. Another law that made some changes for 2016 is Davie County Board of Education is now to be elected on a partisan basis. That filing fee has changed to 1% of the salary, and that's $36. Other counties that were included in that law were Cherokee, Rutherford, Clay, and Iredell Statesville school boards. Then we had House Bill 373 that reunites the presidential preference primary and the general primary for 2016 only. So as opposed to having a February election just for president and everybody else in May, we get to have it at the same time. That's going to be March 15th, 2016, and that changes the entire election schedule. Now, your new filing period is going to be December 1st at noon, and it will go through December 21st at noon. Candidates must have been affiliated with that party for 75 days before filing their notice of candidacy. So anyone that did not change or affiliate with the party by October 7th will not be able to file for the party primary. And there are the current filing fees, and that is based on 1% of annual salaries of the office sought, and that is by General Statute 163-107. Okay, some of the other dates that are important for the 2016 election are absentee voting by mail will begin Monday, January 25th. In the 2012 primary, we mailed out 107 ballots, and then for the general election, we mailed out 1,103. One-stop voting will begin on March 3rd in the Board of Elections office. Additional sites will begin Monday, March 7th. We don't have a plan currently that's been signed off by the board, but we are planning to open the office both Saturdays to accommodate the voter. During the one-stop in 2012, the last presidential election, for the primary, we voted one-stop voters 3,499, and then for the general election, 11,205 there in the one-stop sites. Possible second primary dates are May 3rd and May 24th. We don't have any plans to open additional sites. We will only offer the one-stop voting there in the office. And that is all I have. Do you have any questions?
Questions for Tabitha?
One quick one, Tabitha. Thank you for all you do.
Thank you.
You said 239 people voted early.
Mm-hmm.
Does that include absentee?
That is the absentee and the one-stop.
And you have a breakdown by town?
I do. Just a second. Okay, the town of Coolamy had 10 voters, Moxville 130, and then Bermuda Run 99.
Okay. Thank you.
You're welcome.
Thank you very much.
Thank you.
Next, we have Suzanne Wright, I'm sorry, for Project Lazarus update.
Good evening. Thank you for the opportunity to highlight Project Lazarus and the staff that's responsible for its implementation and success in Davie County so far. Since Project Lazarus is a community collaborative project, you're going to hear information from the Sheriff's Department, from the Health Department, and EMS tonight. Elena Geiger was going to be here to present on behalf of the Sheriff's Department, but she was unable to be here. But it's my pleasure to introduce Brandy Patty, Community Health Education Specialist with the Health Department, and Joseph Ashburn, the Training Coordinator and Paramedic with EMS. And they're going to tell you more about Project Lazarus. Brandy's going to tell you what Project Lazarus is, how it got started in Davie County, and how it's impacting the health outcomes in Davie County too. So at this time, I'll turn it over to Brandy.
Okay, so Project Lazarus is a community-based prescription drug program. It started in Wilkes County in 2008. So Wilkes County started their program because they had a drug overdose death rate 4 times higher than the state. So they started this program, and it's now gone statewide. And last year they approached us to kind of carry on that here in the county. And Lazarus comes from the story in the Bible where Jesus brought Lazarus back from the dead. And that'll come into play here in a minute. It'll make a little more sense when Joseph talks about Narcan naloxone, which helps to reverse a drug overdose. So the problem. What we noticed is through a program called NC Detect that we can see where hundreds of people from our county are going to emergency departments because of medication overdose. It's either accidental, maybe a child accidentally ingested medications, or it may be intentional. But we noticed all these red flags where all ages, from ages 1-year-old to 90-year-olds, are going to emergency departments because of this. And we also noticed through looking through death certificates in this program, NC Detect, that half of all suicide attempts are from medication overdoses. So it's pretty alarming when you see 8- and 9-year-olds that are considering attempting suicide or have attempted suicide. Another thing that threw up some flags, and I don't know if you have heard about Skittles and farm parties, but we've heard where children are raiding grandma's cabinet, mom and dad's cabinet, anyone's cabinet, looking for these medications. They go to parties, put them in bowls, and they just take whatever medications that they can get. So that's pretty alarming. So with all of that information, we decided to get a coalition together. So last year around this time, the health department secured around $20,000 to implement this program, and we've also secured a second grant to tackle some of these obstacles. So last year around this time, the health department, sheriff's department, EMS, and some local pharmacies got together and talked about what we could do. How are we going to fix this issue? And so far, what we have done is purchase 3 medication drop boxes. So these drop boxes look like a medication if you drive up to the drop boxes to put your mail in. That's what these drop boxes look like. And you may have seen them already. There's one at the sheriff's department. There's one at Foster Drug, and there's one at Davie Discount Drug in Coolamy. So these, so by law, they have to be bolted down to the floor, and they have to be under 24/7 surveillance. So on normal business hours, anyone can go to these medication drop boxes and insert their medication. And then the sheriff's department comes at a later date. They have a routine where they come and pick up this medication and destroy it. But any medication can go in there. We do have on there not to put liquids in, but so any vitamins, prescription drugs, anything. And our main goal is just to get these medications out of the home so people don't accidentally or intentionally ingest these medications. We were also able to purchase a incinerator, and so this is housed at the sheriff's department, but they can destroy these medications that they pick up. And so within minutes, these medications are destroyed. And then, so here comes the Narcan, the kits that we talked about, and Joseph's going to share a little more details about it. But we were able to get these Narcan kits to where our law enforcement can carry. So Joseph has trained all of the sheriff's department, and he's going to train Moxville PD and Coolamy PD with these medication kits. But they are for people who have overdosed on opiates. So that could be methadone, it could be oxycodone, those medications, and you could administer that medication and hopefully potentially save their life. But I'll let Joseph talk more about that. Oh, and there's the picture. So that's the one that Foster Drug. So it's the blue box, and you just pull the lid down and put your medication in there. And there's some of the staff that took a picture. And also, we created some material, and so every person who comes through and picks up their prescription through Foster Drug, they get, and actually any of the pharmacies, there's material in there about Foster, or about the program Project Lazarus, and the drop boxes, and just so we're trying to get as many people aware of the program as possible. So now, Joseph, if you want to come share a little bit about Narcan.
Thank y'all for letting us come out to start with. Project Lazarus was intended, like Brandy was saying, is to get the medications off the streets, to take care of some of these accidental overdoses and all, because Davie is the 5th in the state as far as suicide rates. And if we can start getting some of these medications and everything off the streets and everything, then hopefully that's going to go through and help us. Brian has come up and has been very supportive of us going through with this project and working with us as far as what we're doing. As going through and doing the training for the sheriff's department, we went through and broke it up into several different sessions where we was trying to catch them coming off shifts and everything, or coming on shifts. And we've trained every single one of the officers. We've actually went in, and I think we got some of the detention officers as well. But as you see up there where Elena was going to go through and speak about a 28-year-old victim, this was actually about a week after the training was done. One of the lieutenants on the sheriff's department actually run a call because they're usually the first ones in to secure the scene prior to EMS going in and making entry. He recognized the signs and symptoms that we went over with in the training and actually administered the kit and was actually able to get the lady's respirations back up to where she can maintain until EMS was able to get in and start doing just a little bit more. What this medication goes through and does is it's not IV or anything like that. It's actually intranasal. It's kind of like a Adjourn spray. We showed them how to assemble the medication. You put 1 milligram in on one side of the nair, 1 milligram in on the other nair, and it actually increases the respiratory rate. And that's all we're trying to go through and do. We're not trying to wake them up or anything. We're just trying to increase the respiratory where EMS can come in and we can go through and start taking care of them just a little bit better. But that was one of the things that we went through. The state is behind this project because one of the PowerPoints I'm using to actually do the training came from the state office of EMS. So they're on board with this as well. And the big thing is getting the stuff out and making sure, like Brandy said, Moxville PD is next on the list to go through, and then Coolmey PD. With advantage with Coolmey is a lot of their officers, part-time officers, are with the sheriff's department. So we've got a lot of the training done. It's just catching their paid staff. So one of the other things that we're trying to work with is try to work with the funeral homes. And whenever somebody dies of cancer, we want them not to put in there publicly that this is what they've died of, because cancer patients gets a lot of narcotics, and that opens it up for the sheriff's department having more stuff as far as breaking and entering. So we're wanting to be able to go through and take some of this medicine back, so we're getting it off the streets, because there is a lot of it there that we don't realize. So but that's one of the other things we're working on. Also getting with the pharmacists to see if they're seeing a lot of narcotics going to these patients. Let's go ahead and get a kit to them and explain to the family members how to use this, just in case that it's actually like majority of them are accidental. So.
And another thing, as far as the sheriff's department, Elena was going to share this part, but over 25,000 prescription pills have already been placed in these drop boxes. So that's over 25,000 that we have gotten out of homes. So I thought that was pretty amazing. They've done 6 pickups so far between the 3 pharmacies, or the 2 pharmacies in the sheriff's department. They've collected 684 bottles of over-the-counter medications. So that may be your aspirin or multivitamins or whatever. So I'm so thankful that all these departments are able to come together and we can hopefully make an impact and save lives. Go ahead.
Thank you for what you're doing. Question. So that volume you have basically has come. The sources of getting the word out on this, the Davie Discount and Foster. Other than that, I mean, how are you getting the word out to folks?
We put a couple things in Davie Life magazine so far. We're going to put something in the Enterprise. I hope to do some pictures and do an article with that. And then I know the pharmacists have agreed to put material in their bags when you get your medication. And I'd like to put something on our website, and we're still trying to brainstorm some ideas on how to get this out there. Sure. This is kind of our first step.
That's awesome.
I think most all medications usually are labeled, keep away from children, those kind of things, but it seems to me like a much bigger problem here that we probably need to address some way is not that necessarily the excess medicines, but the medicines that everyone's taking, particularly if the youth are going to these parties and taking the pills in, and that's probably not always excess medicine.
Right, right.
Is anything in the plans for that?
Yes, we're gonna meet again soon, but yeah, we've met a couple times. But yeah, that's definitely in the plans, and that's a good point. That's a good point to make. So we're trying to think of all avenues, and where to start, but yeah, absolutely, that's a good avenue to take to educate people. And we're hoping too to get into schools and get the kids involved. I know Dr. Hartness is in support of it. So we're hoping to maybe do some type of competition, a billboard competition, and maybe they could get a scholarship or something, just to get the kids educated on this and involved. So we brainstormed that, and even working with the kids as well.
Because, I mean, that's really alarming the point being that, you don't want to publicize people that have died of cancer because people are targeting their homes. That in itself is just amazing. I would have never thought about that. And so, you got a broad job to do to educate people at all ages about the possibilities and potentials here.
Right.
Wow.
You really do. When he mentioned the funeral home, I've spoke with Eden's Funeral Home, and I'm hoping to contact the others, but they have agreed in their book that they give families kind of a list, a to-do list to do after a death. They're going to put information in there about Project Lazarus and where these Dropbox locations are. So they're going to try to target, all the families that come through there. But I hope to reach all the funeral homes that we have here in the county. And someone from the Sheriff's Department actually made that suggestion. That was a great suggestion.
So to John's point, is there a way to encourage people to secure those medications that are active?
Well, I guess by just trying to educate them. We've also thought about, someone suggested maybe giving away lock boxes or something with a key that they could put up. So that may be an avenue.
In the drugstores perhaps or something?
Yeah, that may be a good way, but
Then
brainstorming on that.
And then you look at it on our end, can we actually get access to the medications to see what they're taking when it's an emergency situation? So there's
Right.
several different give and takes to it.
Sure.
That's one of the things that we've thought about as well.
When these pills are collected, these excess drugs, are they taken and incinerated, or what? How they're disposed of? I'm just chain of command issue.
Yeah, the Sheriff's Department, we have policies. Sheriff's Department, the pharmacies. So the Sheriff's Department, they have the keys, and so they're the only ones that can go to these drop boxes and collect the medications, and then they discard them through the incinerator.
It goes through their evidence stuff.
Yes.
You have a chain of custody process?
You say it's done daily?
No, not daily, just ever so often. Go ahead, Jody.
We set up an evidence policy. They follow the same chain of custody as other evidence. 2 people have to go empty it. 2 people have to count it. 2 people have to sign off on it. They enter it into evidence with property sheets. It's entered into records management when they destroy it. 2 people sign off on it. It's incinerated with the incinerator that they purchased with the grant. It incinerates fairly quickly. It can be done on site right there at the evidence.
And the noticeability of those drop boxes, would educate people, I think, a lot. Are y'all working with Walmart and CVS, Walgreens, all those?
The chain stores are harder to work with because there's so much red tape that you gotta go through. And we're trying to find something for the eastern end of the county to put something in up that way.
Yeah.
So.
It's a very good project. You're doing some good work there, I'd say.
Thank you.
Anything we can do to help you, let us know.
Absolutely.
Thank you.
Thank you.
Thank you very much. All right. Next Next, we move to a presentation on the EMS Regional Championship Competition. And so, Brian, you got that? All right.
I'm very pleased to be here this evening. Thank you guys for having us. And the reason I'm so pleased is I get to present a couple of top performers in this profession. I have with me tonight, I have Kelly Kirk and his son Scott Kirk. As you can see, they both work for us. I've known Kelly for quite a number of years. These guys represented Davie EMS in the state paramedics competition this year. Earlier in the year, they competed against 50 other teams, and they were named the Region 4 champions for that region. Later this year in October, they competed against 4 other regional teams and last year's champions at the finals at EMS Today in Greensboro. When they compete, they are brought into a scenario that they have no idea what they're walking in on, and they're expected in front of this big audience to perform and to do their job. And this year they were presented with a simulated crash of a helicopter and an ultralight airplane. And when they came in, they had multiple patients and that they had to treat and triage, and during the treatment they had a doctor that came on the scene to help, and then the doctor got electrocuted and they had to treat the doctor also. So it's a very stressful, high energy event. They moulage and bring in all kind of props just like a movie set, so it's very realistic. They had an actual Huey helicopter sitting in the conference center to work off of. It showcases all the skills that these guys have, and you know, they got to really like doing this job, be able to put themselves through that. It's very stressful. Several newspapers in the area interviewed these guys, and they made note that they're the first father-son team that competed at this level in the state of North Carolina, so we're really proud of them for that too. Our team gave a great performance. We're all proud of them, and as a service, I just felt we need to recognize their dedication to the profession. So thank you, gentlemen, and congratulations to both of them.
Well, thank you. And would they like to say anything about their accomplishments?
You got anything you want to say?
Competition?
This is worse than the competition.
Well, congratulations, and thank you for everything you do. So,
Good job.
Thank you.
right, next we have a public hearing on the proposal to, it says purchase Davie County Home Health, but I guess it would be to sell Davie Home Health, so we will enter into the public hearing. Mr. Vogler, you want to?
Yes, Mr. Chairman, members of the board, on the agenda is a public hearing on the proposals to purchase Davie County Home Health Agency. A resolution declaring the county's intent to sell was passed on August the 3rd, 2015 by you commissioners, and a public hearing on the resolution of intent was held on September the 8th, 2015. The commissioners will be accepting public comments on the proposal, which pursuant to North Carolina General Statute 131E-13D6 has been available to the public for at least 10 days before this public hearing on the proposals in the county manager's office. This public hearing has been duly advertised, noticed by publication at least 10 days before this hearing, and is being conducted pursuant to North Carolina General Statute 131E-13D5. Now is the time for anyone who wishes to comment on the proposals to come forward to do so. This is a public comment only. There shall be no questions and answers between the speakers and the commissioners. And I would ask that each speaker come to the podium, state your full name for the board, and then make any comments on the proposals received by the county. Thank you. Seeing no one coming forward to comment, I would now turn the public hearing back over to the county board and to the chairman with instructions to declare the public comment section of this public hearing closed and or to close the public hearing itself. There's no action is required of this matter tonight. However, just as information, we do anticipate action possibly being taken on the December 7th, 2015 meeting at that point in time. There should be other documents available for you.
All right, we will officially declare the public hearing closed, and unless anyone has any comments, questions. Okay. Well, okay, I will declare the public hearing closed. And we will move to the next item on the agenda, which is the consent agenda. Several items on that. Did anyone have any questions about any items on the consent agenda? Seeing none, I will entertain a motion to approve the consent agenda.
So moved.
Motion, do I have a second?
Second.
Second. All in favor, raise your hand. 5-0. Thank you. Next item on the agenda, for everyone in the audience, I know we have an astute agenda. You will see that Mike Ruffin's not here, so I will call on our acting county manager, Robin West.
Yes, I have 2 items I'd like to report. I'd like to let everyone know that Davie Domestic Violence and Rape Prevention Services has moved from the 3rd floor of this building to 172 South Clement Street in Suite 2, which is at the corner of the same block that we're in, the back of the building. They moved successfully and had an open house a few weeks ago and are very excited to be in their new space. Also, last week on Tuesday, October 27th, we had Employee Service Awards. We did something new this year after we formed a committee to see how to make the Employee Service Awards a little bit better. We had a reception here where we gave a presentation box, and Cindy from my office was nice enough to let me show this was included in the box. That's a personalized certificate of appreciation, as well as a catalog of items that they could choose from and have the item shipped to their home instead of receiving a years of service pin. And that went over really, really well. We got lots of good comments from the employees, and it was very well attended. Also, we had a 30-year employee, Karen Jones, from the health department, and we're hoping to have her back at a later commissioners meeting. So,
All right.
that's it. That's all I have to report.
Good job.
Thank you.
You're doing a fine job. Thank you. We want to congratulate all the employees for their service awards, and to all the employees, again, thank you for everything you do. We got a fine staff here in the county. All right, we'll move to old business. Does any old business to come before the board this evening? Seeing none, how about any new business? You got it all under control, okay. All right, we'll move to commissioners' comments. Mr. Jones.
Just very brief, thank you all for coming. We really appreciate all the presentations tonight. A lot of great things going on, a lot of effort being put on by staff to serve the community, and I really appreciate that. And I would like to thank all of our staff, but especially those that put the reception on last week. That was really nice, and took a lot of work, and our staff was, all those that were here and those that couldn't be here were very deserving, and I'd like to thank, I don't want to mention names because I'll miss somebody, but I'd like to thank all those that worked so hard to do that. Thank you, Mr. Chairman.
Thank you. Mr. Barrett.
Well, I first want to say it's nice to see everybody out on a night like this. You have to really be dedicated to come out, so thank you for coming out. And I want to really appreciate the Project Lazarus report, Joseph and Brandy. That was really good, and I think that's just a testament to what the county has going on in different places all the way across the county, so that's really nice. And Brian, please convey our appreciation to the Kirks for that wonderful competition and for what they accomplished there. That was really nice. And to all our employees who are so dedicated, we really appreciate your service. The award ceremony the other day was very nice. So thank you to our staff for putting that on and for everybody who participated. And we're just very blessed to have such wonderful employees here in Davie County. So thank you.
All right. Mr. Ferguson.
Well, I would like to echo the comments that have been made earlier. Our staff is really, really important. And the reception the other day was, I think you really got to see a lot of our employees there and how much they do mean to this county. And it's hard for us to thank them as much as we need to, because they're the ones that really makes things work. It's the winter time's coming up, and they're going to be out here in bad weather and all kinds of things, and we're going to have hopefully everyone will have water and sewer and EMS people to get there if you need them, and the sheriff will be there if you need them, and This is important, and it takes people like you to do that, and we appreciate that very much.
Poindexter.
I think everybody has pretty well said everything that needed to be said that I could have said too. I can't agree more with the comments that were made, but thank you all for coming out tonight, and hope to come back next month.
I can't really add anything to what's been said other than thank you for being here. I always like to see faces in the crowd. We have the same one. A lot of the same ones are really committed because we're here every week, and that's or every month rather, and we're appreciative of that. But all new ones are certainly welcomed. Been a lot of thank yous tonight, but next week is Veterans Day, and that is certainly a debt of gratitude that can never be repaid, in my opinion. And I want to thank all the veterans and what they've done for the country and for us individually. So with that, thanks for being here, and we will hope to see you at the December meeting. Entertain a motion to adjourn.
So moved.
Second.
Motion and a second. We are adjourned. Thank you.